A or B. If you want this job doing properly, you need to choose option B. I don't really give a shit which one you do, but I'm telling you now, through years of doing it, that when you give them that choice, 8 out of 10 want the job doing properly. All frustration about money, all doubts, all, oh, I don't want to be accused of being salesy and whatever else everybody worries about, disappear in a heartbeat. Because why? They chose it. So here we are in Dublin. We have just finished a strategic planning day where basically I've just taught business owners how to make more money in the next 12 months than they have in the previous 5 financial years. It's a pretty cool day. And one of the things that we look at is ultimately, how do we get patients to have more sessions? How do we get people to buy in to having more sessions with you? Because one of the fastest ways to grow a business is ultimately not to get more patients, it's to get less patients, but have those patients spend more money with you. It's a pivotal shift in the way that you see your business. Now, one of the pushbacks that I hear all the time is, well, what if patients only want to have a couple of sessions? What if my therapists, I tell them the plan that we're going to move our patient visit average from 2 or 3 sessions to 7 or 8 sessions, which ultimately, if you think about that from a business point of view, if I can get your business to go from having an average of 2 or 3 visits for every patient to 7 or 8 visits for every patient, the difference that that will make to your business is probably in the tens of thousands, if not hundreds of thousands of dollars, depending upon the size of your current business. But one of the problems is the bullshit mentality that people often have when it comes to actually telling patients what they need. There is so much fear, there is so much doubt, there is so much, what if the patient pushes back? What if the patient doesn't like the fact that you tell them what they actually need? One of the things that we've got to do is ultimately, I believe, as practitioners, as business owners, we're not here really to tell patients what they need. We're ultimately here to give them the choice. Because what do we all want in business? What do we all want in life? We all want the best choices. The people with the best lives, ultimately, they have the best choices. I believe the best thing that we can do for patients is to at least give them the choice. Give them the choice of whether they want option A, the average 2 or 3 sessions to solve their pain, option B, the complete transformation, the 8, 9, 10 sessions that they actually need to solve their real bigger problem, right? Let's put an end to all of this worrying about what patients think about us. Let's put an end to worrying about what our peers think about us. Let's even put an end to what our fucking staff think about our new plan to make more money. The plan that I propose is a plan that not only makes more money for business owners, but ultimately helps patients get healthier and get better. There is no patient in their right mind, all right, 1 or 2. There are 1 or 2 patients out of their mind who do not want the best for themselves. I put it to you that the reason that patients won't have more than 2 or 3 sessions with you is because you won't give them the choice. And it's often as simple as this. Mr. or Mrs. Smith, you have back pain. There are 2 ways that we can solve that problem. Number 1 is the cheapest and the easiest and the least effective, but it will get you out of pain. If you just want some pain relief, have 2 or 3 sessions. However, if you want the complete transformation, you want me to solve this problem so that it limits the likelihood that this problem will come back anytime soon, so that you have the best possible shot of remaining active and independent, free from the likelihood that you'll need surgery, free from the likelihood that you'll need to spend the rest of your life depending upon painkillers. If you want that option, that will take 8 or 9 sessions. Which do you want? The choice is all yours, Mr. or Mrs. Patient. You stop really worrying about the money aspect of it and just tell them what they fucking need to solve the problem, not get out of pain. It's not what we do. The business, my business really moved on when we moved to that mentality. That if you just want pain relief, fine, we'll do it. But if you want the job doing properly, this is what it looks like. And 8 out of 10 people want the job doing properly, that if you position it to them right, they will take it. It defies logic. It's like you sitting in the dental chair and I'm saying, well, look, I can do this 1 or 2 ways. One is the really cheap way, and I'll remove half of the decay, and I'll leave you with just a little bit of decay that won't cause you too much pain, but will still keep you awake at night. Or I can get you coming back 3 times, and we can remove it properly. I can get rid of the nerve. I can make sure that you never ever be in any pain ever again in your life. It might cost you an extra few £100, but it'll solve the problem. What do you want? I'll have B. Yes or no? That's it. That little phrase I've just given you there and that understanding of your business will change it. What we've been conditioned to do as physios is usually as least amount of sessions as possible to get them out the door. Which is like you going to the dentist and him doing or her doing the least amount of work to solve the problem just to save you a few £100, but set you up for a lifetime of tooth decay and gum disease and whatever else. That when we've got these people coming through the doors with ankle sprains, knee problems, hamstrings, that are all symptoms of other problems that they've got, which they are, we're letting them walk out the door with a patched up little bit of ultrasound and a few sessions of friction and stretching, that yeah, it feels better, but it doesn't solve the problem. All I asked my physios to do was to give patients the choice. You tell me how much you want to spend. Because yes, I can be like every other physio in England, and I can give you 2 or 3 sessions for this ankle sprain, but I ain't going to fix your problem. So I put it to you that one of the fastest ways to grow a business is to improve what I call your PVE, your patient visit average. And you'll do that by changing what you mean for the patient. You'll do that by moving away from being a provider of pain relief. That, by the way, any pharmacy, Vons, Walgreens, anybody can do that. Anybody can provide pain relief for a patient. But what patients really, really want is a complete transformation. They won't buy it from you unless you offer it to them. And the best news is if you offer it to them, you've given the choice. Ultimately, what people want is the choice. They don't want to feel railroaded into having to buy things from you. They want to feel empowered by you. If you give them the choice, they will, most of them, take option B, which is the complete transformation, the complete removing of the decay, so that they're in less pain for many years to come, and they'll ultimately thank you for giving them the choice. Stop worrying about what they think. Stop worrying about what other people think. Stop worrying about what your staff think, and ultimately care more about what you're doing for patients, which is giving them the choice. The thing that they want over and above anything else that you do for them is the choice. The feeling as though they're in control of this situation, which if you tell them option A, 2 or 3 sessions pain relief, option B, 8 or 9 sessions, solve the problem that you've got once and for all. I put it to you that 8 out of 10 of your patients will take option B to have the problem solved. There'll be no pushback, there'll be no fighting, there'll be no feeling as though you sold it to them. And as a result, not only will your patient numbers go through the roof, your profits will go through the roof, you'll actually get more referrals from people just like the person who chose option B, who wants the complete transformation. Most businesses are hurting right now because they're selling option A, and as a result, they're attracting more patients who want option A. You need to find more and more patients constantly, and it's becoming harder and harder to do that. It's becoming more and more expensive to find the patients that you need to make the level of profit that you want. The best news is, the choice is all yours. Are you going to give them option A, or are you going to give them the choice of option A or option B? Completely up to you. But factor in your profits will depend upon it, and your business will be much easier to run should you give them the choice of option A or option B. Very, very easy. Take your pick. And all you did was give them the option, which is, by the way, I believe, our absolute duty to do. There is not our right way, there is not our one way, it's the way that the fucking patient wants. Our job is to position it in such a way that they take the one that is right for them. That if you do, actually even benefits the business. Following? That's how many of you will go from 3 sessions to 6 or 7 without any pushback whatsoever. Let them decide how many sessions they want to have.